Hey guys, welcome back. This is Dr. Ashram Wadera, foot and ankle surgeon and podiatrist. And today I'm going to talk to you about a very interesting topic and something that I'm very passionate about: minimally invasive foot and ankle surgery. So let's start with talking about what exactly is minimally invasive surgery. What that means is I make a very tiny incision to take care of your problems. I hope that makes sense. Well, there's actually a lot of things that we can fix with foot and ankle surgery, like bunions, hammer toes. We can make really short toes, create them of a normal length again. We can take very long toes and shorten them to make them look natural. We can fix fractures, minimally invasive. We can take care of arthritis from a minimally invasive approach. I can fix ligaments, tendons, minimally invasive. Use of minimally invasive foot and ankle surgery is endless. Let's talk about the differences between a traditional open approach versus minimally invasive. And we'll use a bunion, for example. In traditional bunion surgery, we're making very long incisions on the foot. This allows us to get to the bone, allows us to fix the bunion by either cutting the bone or releasing some ligaments and then putting them back together with hardware. And typically we put a lot of sutures in the foot. On average, we're typically keeping you off your foot anywhere between 2 to 3 months. The difference between traditional and minimally invasive is that minimally invasive is made through a very, very tiny incision. In some cases, we don't even use sutures for the minimally invasive approach. What are the advantages, you're probably wondering, of a minimally invasive approach versus a traditional approach? I'm using a bunion as an example here, but this can apply to really any of the procedures that we're talking about. Well, for one, there's a very aesthetically pleasing closure, meaning there's no big scar. It's like a cosmetic approach, and it's more like a cosmetic closure. It looks really nice, and in some cases, some patients, it looks like they hadn't even had surgery 2 to 3 months later down the road. And it's really impressive. Whereas with the traditional open approach, there's really long scars, like I mentioned before, and they can look really ugly, and people can feel very self-conscious about that. So an aesthetically pleasing closure is really important to some people, and I totally understand why. There's minimal swelling with minimally invasive foot and ankle surgery too. With a traditional open procedure, there is a very, very big incision. And so in that case, what we need to do is we need to make sure that we're pulling apart the nerves and arteries to protect the patient. That technique, it creates a lot of swelling afterwards, and that swelling can last upwards of a year or a year and a half, and that's very realistic. Whereas with the minimally invasive approach, with a very small incision, there's no trauma to the surrounding tissues, and so there's very little swelling, if any. And it's very nice for the patient because patients are able to get back into their shoe gear, that is regular shoes, pretty fast. And I let my patients get back into their shoes at around the 4-week mark. And in some cases, some patients will get in even sooner. That's not the case for everybody, but typically 4 to 5 weeks is my goal for most patients. A big thing that patients wonder is pain. To say there's zero pain, I'd be lying to you. There is some pain, but it's nowhere near the same as a traditional open procedure. Now, everybody's pain tolerances are different, but on average, most patients feel minimal pain with the minimally invasive approach. Again, it comes down to this really small incision that we make, and there's less trauma to the surrounding tissues. And so patients are really amazed with, 2 days after surgery, 3 days after surgery, they're not feeling any pain. They're not taking any significant pain medication. And in most cases, most patients are pretty much taking like an over-the-counter Advil or even some Tylenol. Whereas in traditional open procedures, patients are being prescribed narcotics. And most patients will typically be okay with narcotics, but again, we'll talk about that in a different video. I want to focus more on this minimally invasive approach. And the big thing, and this is the most exciting thing about minimally invasive surgery, is that there's minimal downtime. And I actually let my patients walk day 1 in a walking boot with a minimally invasive approach. Now, let me be clear. This is mainly for bunions and hammer toes. And when it comes to fractures and ligaments, every doctor is different, but in those cases, you're still off your foot for a couple weeks. But again, I'm focusing more on the bunions and hammer toes. These cases, typically right after surgery, I'm placing you in a boot for 2 weeks, maybe 3 weeks, and then I place you in a special shoe called a post-operative shoe. It's like a sandal that just gives you support. So some patients have difficult time getting back into their normal shoes with traditional open surgery, and that could be sometimes, in some cases, 6 months or even a year. Now, a year is extreme, but I've seen it. The biggest thing that most patients suffer from with traditional open surgery from a foot and ankle perspective is swelling. And I always tell my patients, give yourself a year and a half to feel like yourself again. I think that's a very realistic time frame. But I've noticed with minimally invasive surgery, the swelling is not as drastic, and it's really amazing. There's less risk of infection with an open approach. The incision's open to the surrounding environment versus the minimal approach. There's less likely chance of you having a postoperative infection. There's also less likely chance of you having what's called a DVT or a blood clot, which can be life-threatening. Again, because I'm letting you walk day one in your boot versus keeping you off your foot. So again, there's so many advantages to minimally invasive foot and ankle surgery, and I love this procedure. And the crazy thing is that this procedure is not new. It's actually it's an older technique, and it's becoming more popularized right now. And the advances with medical technology, there's so much that we're able to do. From my perspective, I'm extremely passionate about minimally invasive bunion surgery and hammer toe surgery, more from a cosmetic standpoint. It's super gratifying for me to see my patients see their bunions. There's very large bunions that are painful, not only physically painful, but emotionally painful for them. They're embarrassed, and I get it. They come in, and within an hour, their bunion's gone. They come in for their first post-op visit, and they're so amazed with there being little sutures, and in some cases, no sutures. And a lot of them are afraid. They think they have this huge scar, and they see a couple little poke hole incisions. We call these keyhole incisions. It's amazing, and I'm so passionate about this procedure. I love this procedure. I love this technique, and I utilize it as much as I can. I continue to practice this on a weekly basis to better serve my patients. So if this is something that you're interested in having, please reach out to me, reach out to my office, and I'd love to help you out. I think you could potentially be a wonderful candidate. Now, I will say not everybody is a candidate for this surgery. You're probably wondering, so am I a candidate? I'd say most patients are candidates for this surgery, but in some cases, we do have to open you up. These are the type of patients that are maybe having revision bunion surgery who have previous hardware. And again, I still do this through a minimally invasive technique, but it's not going to be probably as small as I would be able to if it's a virgin bunion or a virgin hammer toe. But again, most patients are candidates, and I get a lot of patients that come to me telling me that they had seen several other doctors in the area that have recommended this big open procedure, and that they're going to be off their foot for many months. And it's it's just so gratifying for me to see patients who are fearful of surgery, and specifically bunion surgery, and hearing all these crazy stories, and then they come to me, we fix them, they're walking day one, and they're super happy. So again, I hope I can help you. I hope this video is helpful. Minimally invasive surgery is incredible. I don't know why you wouldn't want this done for yourself if you need a foot surgery, more like a bunion surgery or hammer toe surgery. It's amazing. Reach out to me. Thank you.